Here are a few important facts about medications used to treat osteoporosis. The gold standard of treatment is zoledronic acid. There are many myths around this drug online. You can find claims that it causes osteonecrosis of the jaw, but this only happens when extremely high doses are used. Such doses are given in cases like osteosarcoma, where the medication may be administered almost weekly. When we are treating osteoporosis, zoledronic acid is used only once a year. With this dosing schedule, developing osteonecrosis of the jaw is practically a medical myth. What can actually happen, however, is a different complication. If this drug is used in people who already have low calcium levels in the blood or problems with calcium absorption, zoledronic acid will actively move calcium from the blood into the bones. This can lead to hypocalcemia, but dangerously low level of calcium in the blood. That is the real risk doctors need to watch for. This is why, before starting therapy, it's essential to simply check the blood calcium level.